Howdy! Today we will be discussing the female reproductive system and two diseases which affect it, endometriosis and polycystic ovary syndrome. Hello, my name is Sophia Valls. I am a sophomore biomedical science major planning on attending dental school.
Hi, my name is Gabriela Benitez. I am a sophomore biomedical science major, and I plan on going to medical school after undergrad.
I am Natalie Franco. I am a junior biomedical science major planning on attending veterinary school.
My name is Alyssa Reyes. I am a sophomore biomedical sciences major planning on attending veterinary school.
The system we are studying is the female reproductive system. In this system, the main role is the creation, the fertilization, and the development of female eggs or oocytes in order to produce offspring. The anatomy includes the ovaries, the fallopian tube, the uterus, the endometrium, the vagina, the Bartholin's glands, and the breast/the mammary glands. I'm going to go into depth on what each of these organs does. So first is the ovaries, where the oocyte production takes place. Next, you have the fallopian tubes, where the fertilization actually occurs. Then you have the uterus, where the offsprings develop, and that's where the womb is. In the endometrium, the uterus, that's the uterus lining. The fertilized egg becomes embedded here. Next is the vagina, where the site of penetration occurs, and it's the birth canal. In the Bartholin's glands, these are the glands that are located next to the vagina, which secrete mucus and fluid. And lastly, you have the breast/the mammary glands, where the milk is produced and then fed to the offspring. In the female repro system, you have a menstrual cycle, which is an average duration of 28 days in the females that are of childbearing age. In this organ system, you have a lot of hormones involved. These include the follicle stimulating hormone, which is known as the FSH. You have the luteinizing hormone, which is known as the LH. You have the most commonly known one called estrogen, and you have progesterone. You have several phases in your cycle. So the first phase is the follicular phase, which is the FSH and the LH hormones are released, and these hormones travel through the blood into the ovaries. This stimulates a growth of about 15 to 20 eggs in individual follicles. An increase of estrogen is triggered in this phase, and dominant follicles continue estrogen production. The next phase in the cycle is the ovulatory phase. In this phase, the egg is released and it is swept into the fallopian tube. In this phase, the mucus will thicken in order to nourish the sperm in order to have fertilization occur. The next phase in the cycle is the luteal phase. In this phase, the development of the corpus luteum takes place, and this is where the progesterone is secreted. And in this phase, the uterus is prepared for implantation. If an egg does become implanted, the woman becomes pregnant. Lastly, you have menstruation, and this only occurs if an egg is not fertilized or implanted. The system will menstruate, or it'll shed its uterine lining, called the endometrium.
Our first disease is endometriosis. Endometriosis is the presence of endometrial glands outside of the uterus. Endometrial glands or uterine glands are glands found in the endometrial uterus lining. They provide nutritional support and have a role during implantation. What occurs in endometriosis is tissue growing on the outside of the uterus starts to thicken. As this happens, it starts to break down and bleed with each menstrual cycle. The tissue has nowhere to exit the body, so cysts begin to form, resulting in symptoms such as painful periods, bowel movements, pain during intercourse, as well as excessive bleeding and infertility. This disease is not very common. It affects 10 to 15% of all women in reproductive age.
Endometrial glands, also known as uterine glands, are glands found in the uterus lining. In the images below, it can be seen that these glands consist of columnar endometrial cells.
Causes of endometriosis. Retrograde menstruation, which is where tissue backs up through the fallopian tubes into the abdomen, a sort of reverse menstruation where it attaches and grows. Then there is transformation of peritoneal cells. Cells in any location may transform into endometrial cells. There is also surgical scar implantation, where endometrial cells attach to surgical incisions after a hysterectomy or C-section. Lastly, another cause is endometrial cell transportation. Endometrial tissue may travel and implant via blood or lymphatic channels, similar to the way cancer cells spread.
The image on the right displays endometriosis in the ovary. Macrophages, endometrial stroma, and the columnar endometrial cells can be seen. Below, the diagram displays the presence of endometriosis on the female reproductive system.
In diagnosis of endometriosis, it often presents itself with no symptoms. It can be misdiagnosed due to this. It can efficiently be diagnosed with a laparoscopy and biopsy of any suspicious tissue. It can also be diagnosed with non-invasive procedures such as MRI, CT scan, or ultrasound, but they are not efficient in diagnosis. Symptoms are painful menstrual cramps, pain when having sex, chronic pelvis and lower back pain, painful bowel movements, bleeding or spotting between periods, infertility, which is a common symptom, digestive problems. In endometriosis, it is a chronic condition, but there are ways to relieve symptoms for treatment. Hormone therapy, pain medications, surgical treatments, and IVF for problems with infertility.
The next disease we will be discussing is Polycystic Ovary Syndrome, also known as PCOS. PCOS is a hormonal disorder found in women with abnormally high levels of male hormones and extremely irregular menstrual periods. Women with this disorder commonly have difficulty having children due to the irregularity of their menstrual cycle. They can take medications such as birth control and diabetes preventatives to regulate the symptoms. PCOS is very common in women of childbearing age and can affect 1 in 10 women. The diagram displays the difference between a healthy ovary and the ovary of somebody affected by polycystic ovary syndrome. The unhealthy ovary has cysts. The healthy ovary does not. The exact cause of PCOS is not known. However, genetic factors, insulin resistance, and inflammation are all linked to high levels of androgens, or male hormones. It is known that insulin resistance is strongly associated with PCOS, but it is unclear how insulin resistance influences reproductive factors in women. High levels of androgens can prevent the normal release of eggs during ovulation and could prevent the ovaries from producing hormones, progesterone, and estrogen. Androgens also result in an excess amount of hair growth, which is one of the symptoms of PCOS. The H&E stained ovaries in the images on the right display the difference between a control group and ovaries that are affected with PCOS. Follicular cysts are obviously present in the PCOS groups. What are the symptoms of PCOS? How is it diagnosed? And what treatments are available? Usually it is diagnosed when 2 of 3 of major symptoms are present in a patient. These 3 symptoms are high levels of androgens, cysts on the outsides of ovaries, or irregular periods. Blood tests can be used to test hormonal levels. Ultrasounds test abnormal follicles on the ovaries, and pelvic exams check for growths on ovaries or the uterus. Other symptoms include acne, obesity, infertility, abnormal amounts of hair on the body, skin tags, or thinning hair on the head. There is no treatment that cures PCOS, but there are medical and home treatments available to assist in managing the symptoms. Home treatments include losing weight, removing hair, limiting carbohydrate intake, exercising, and just keeping active. Medical treatments include hormonal birth control, various other medicines, and metformin, which is a type 2 diabetes medication to assist with insulin levels.
Now it is time for the exam questions. The first question asks, what function does not match the female reproductive system organ? As we learned earlier, the function of the ovaries is where the oocyte production occurs. Therefore, A does not match. The other two organ systems match because milk is produced in the mammary glands, and a fertilized egg becomes embedded in the endometrium. So A is the correct answer. The next question asks, what condition matches definitions? Definition of endometriosis is the presence of endometrial glands outside of the uterus. And polycystic ovary syndrome is a common hormonal disorder in women of childbearing age where the menstrual periods are extremely irregular and the levels of male hormones are abnormally high. Therefore, D is correct. The last question asks, this diagram matches which condition? In the diagram, you can see there are cysts within an ovary. So immediately you know that the condition it is talking about is polycystic ovary syndrome. B is the correct answer because A is spelled incorrectly.
These are our works cited. Thank you very much for listening to our presentation. Giga Maggies!